It's a battle over how someone's final hours are spent. On the one side, church-run healthcare facilities who say medically assisted dying isn't in keeping with their religion. On the other, plaintiffs who say they're being denied their right to a dignified death. Back in 2023, Samantha O'Neill was dying of cervical cancer and opted for MAID. But because she was at St. Paul's, a Catholic hospital, she wasn't allowed to have the procedure and was forced to transfer. Now her mother is part of the legal team challenging the policy. If this heads to the Supreme Court of Canada, it could have implications for the entire country. Here's why. First off, the number of people receiving MAID in Canada is growing. There were more than 16,000 provisions in 2024, and that number is likely to increase as Canada's population ages. Second, transfers for MAID are actually pretty common. A lot of the time, these transfers are for the patient's own benefit. Say they're in a hospital and want to die at home. But Health Canada data shows several hundred patients a year are transferred in the final hours of their life, not because they want to be, but because of the policies of the facility where they're being cared for. This was the reason for a quarter of MAID transfers in 2024. Health Canada data also shows that transfers for this reason are actually more common outside BC, even though the case at the centre of it happened in Vancouver. About a third of MAID-related transfers in BC happened because of the policies of the facility in 2024. But that figure rises to 77% in Manitoba and 74% in Alberta. Not only that, but each province has its own way of handling this. BC's policy, which is being tested in this trial, says faith-based facilities receiving public funds don't have to allow MAID in their buildings, but they can't impede requests for it or access to information about it. That's basically how it works in Alberta, Manitoba, New Brunswick, and Newfoundland and Labrador. But Saskatchewan and Ontario have no policy on this and leave it to individual institutions to decide. The only province where faith-based facilities do have to allow MAID is in Quebec, and that policy is being challenged by the Archdiocese of Montreal. You might be wondering, could this mean people who don't agree with medical assistance in dying are forced to participate? No. This case is only about the building where MAID can happen. The plaintiffs want MAID allowed in these facilities, provided by people who don't work for the faith-based institution and who are able and willing to do so. Carman, CBC News, Vancouver.